Welcome to this video summary of the publication describing the long-term safety and efficacy of Oleogel-S10 birch bark extract in epidermolysis bullosa. My name is Professor Dede Murrell.
And I'm Professor Johannes Kern. On behalf of the co-authors, we'd like to describe the outcomes of this important study for epidermolysis bullosa, or EB.
EB is a group of rare genetic disorders characterized by fragile skin and impaired wound healing. It severely impacts the health and quality of life of individuals with EB and their families. Wound healing and management are crucial priorities in these patients.
Oleogel-S10 is a topical gel containing 10% birch triterpene extract that is applied with a sterile, non-adhesive wound dressing, either directly to the wound or on the dressing.
EASE was the largest ever clinical trial conducted in EB and followed the patients over 2 years. After completing the 90-day randomized double-blind phase, or DBP, the patients entered into the open-label phase, or OLP, to receive Oleogel-S10 for up to 24 months. 205 patients entered the OLP. The median age was 12 years, and most patients were under 18 years old and had dystrophic EB.
Oleogel-S10 was well tolerated, with most adverse events being mild to moderate and associated with the patient's underlying EB disease. These occurred at a similar frequency in the OLP compared to the DBP, as well as between treatment groups in the DBP. The most common adverse events were wound complication, anemia, and wound infection. 12.2% of patients had adverse events related to Oleogel-S10, and of these, only 2 were serious. Related serious adverse events resulted in the withdrawal of a single patient.
In terms of efficacy, long-term reductions in wound burden were observed with a sustained reduction over 24 months. The mean body surface area percentage, or BSAP, generally decreased over time. There were significant BSAP reductions from the DBP baseline at all time points. It's helpful to visualize this reduction in wound burden by using hands, because 1% BSAP is roughly equivalent to the surface area of one hand. The EASE study also used the epidermolysis bullosa disease activity and scarring index, or EBDASI, to measure wound burden. This graph shows a reduction in mean EBDASI skin activity scores throughout the study. Mean changes at all time points were significant from DBP baseline. In conclusion, these data support Oleogel-S10 as a well-tolerated topical treatment with a reassuring long-term safety profile. These data are clinically meaningful and important to consider, given the significant impact wound burden and wound care are reported to have on daily activities for patients, their caregivers, and their families.
We would like to thank the patients, caregivers, investigators, and funding sources who made this study possible.